Good day, this is the Professor, CBMD PhD, and today is Friday, November 17th, 2023. It is 2:25 and 29 seconds, AM Eastern Standard Time, and today's research, bladder cancer. So let's hum to it here. The scientific investigators and microbiologists make a breakthrough in bladder cancer research. Date November 16th, 2023. Source, Netherlands, Cancer Institute. 40 years chemotherapy has been the standard treatment for bladder cancer patients who can tolerate this medicine. However, the results were limited and lasting results were rare. In recent years, two groundbreaking phase 3 clinical studies have focused on a new form of treatment to improve this. They investigated the effects of combining immunotherapy and chemotherapy. And traditionally, cisplatin-based chemotherapy has been the standard treatment for bladder cancer patients who are able to tolerate this drug. However, responses have been limited and durable outcomes rare over the past years. Two phase 3 clinical trials studied the effects of combining immunotherapy with either chemotherapy or a new drug. And Professopher to treat bladder cancer, more exact, urothelial carcinoma, for success. Both studies show a significant increase in both overall survival as well as progression-free survival. These results mark a milestone in bladder cancer research, providing the first evidence of a survival benefit of combination therapy involving immune checkpoint inhibitors over chemotherapy. And this is an exciting development in our field, as these findings will thoroughly change the treatment landscape for advanced bladder cancer. It is a testament to the collaborative efforts of researchers and, most importantly, the resilience of all patients who participated in this study. The Checkmate 901 trial investigated a new combination of the drugs, nivolumab and gemcitabine, cisplatin, and compared this to treatment with only chemotherapy. The results demonstrated that patients treated with both drugs showed a 22% reduction in the risk of death compared to patients only treated with chemotherapy. The findings also show that the combination of nivolumab and chemotherapy led to a significant improvement in progression-free survival versus chemotherapy alone. The results of another phase 3 for the same treatment line will be presented, featuring a combination of an antibody drug conjugate with immune checkpoint inhibition using enfortumab vedotin and pembrolizumab. As both treatments are yet to be registered and approved in the Netherlands for health insurance coverage, meaning that they will not yet be readily available in the U.S. The enfortumab vedotin plus pembrolizumab is already available for a subgroup of bladder cancer patients based on a phase 2 study. And this is the Professor of Microbiology, Bioinformatics, Pathophysiology, and Lead Research. This video was created for educational purposes only. Hope you enjoyed listening. Until next time, have a great day.